Hi, I'm Gary White with Channel 6 Central Kentucky Television, and I'm here with Linda Sims, who is with the Lincoln Trail District Health Department, and we're going to talk about some changes that are coming to the health departments for us here in Marion, Washington, and Nelson County, the whole Lincoln Trail District.
Yes.
And these changes are coming about because of some funding issues with the state, is that correct?
Correct.
Okay. Tell us a little about what some of these changes are.
Well, a lot of the impact of the change, again, is due to the direct funding reductions that we've seen in this fiscal year's budget. For the Lincoln Trail area, it was a little over $500,000. So we, as the expenses have gone up in serving some of the population that we traditionally do, those programs have received less funding. And so what we're doing is stepping back to look and revisit as what's our mission and how can we do that with the margin that we have. And so with those funding changes, we're shifting back to looking at the target population and focusing on those individuals that need prevention services who do not have the means to pay for it. They do not have insurance or the financial economic opportunities to do so. So in the past, we've tried to be a very open, available concept for prevention services for a variety of reasons, but with these changes we're saying we can no longer accommodate helping those who have insurance to get some of the prevention services that we do, particularly family planning, breast and cervical cancer, and a few other miscellaneous programs that we do, and we're trying to link them back to a medical home, which many of them do have. You know, they have their primary care provider who can assist them with that service. So it's not like they're just being left without service. That, you know, there's availability for them to get the service.
So what we were saying is some people in the past who have access or have insurance and may have a primary care physician may have come in the past to the health department for their shots or for contraception or something of that nature. Those individuals will no longer be able to receive service from the health department. Is that correct?
Right. When they call for an appointment, we're advising them of that, and when they come in, you know, reminding them too. We're also doing proof of income and, you know, having patients to sign that they don't have insurance, because sometimes that's not always reported. And again, our funding is so limited anymore, we really want to make sure we use it where the true need is. And so the population that has no means and low income are really where we're going. So.
Now, the health departments in our communities are funded solely from tax dollars, is that correct?
No, there's a variety of funding. Majority of our funding will come from state and federal dollars, but that has been shrinking. And so we get an additional, we have been getting a 1.8 cent tax from each of our counties, which is based on real and personal property, and that's your public health tax. So for us, that's about a 15 or 20% of our funding. In the past, the majority of the funding we've got was always with service fees, where we charged for like environmental service, for permitting, or for whether it's a home health service or even in the clinic. But that is a shrinking dollar too. And on the health insurance patients, we are not able to collect all the time for the services we do. If you get an immunization, we're not able to collect unless it's a flu shot, and where a physician can provide it and bill that under the insurance. It would pay for the nurse practitioner, but very limited on the other services we do.
So you do want to mention that, because I had someone, when I mentioned what was going on with the health department, they were saying that they were under the assumption that if you had insurance in the past and you went to the health department, that you billed the insurance company just the same as if you go to a primary care physician, and that's not accurate.
Well, what happens, we may bill them, but if the patient has a deductible that has to be met or a high deductible, it doesn't always get paid to the health department. And so a lot of times, or the services we bill for, if it's not a nurse practitioner, will get denied. So we end up a lot of times unable to collect that insurance reimbursement, and many times the patients may not reimburse the health department, because, you know, in the past a lot of people have seen the health department as free services, and what we do free is a lot of what we do on our day-to-day services that we really don't get a lot of attention for, because I think we do it well, but it is monitoring on a daily basis what type of communicable outbreaks going on, such as we were talking about, whether it's a foodborne illness or a norovirus in the nursing home, or whether, it's we've been seeing more whooping cough or pertussis. Those are our critical core services that we do daily, and as well as the environmental inspections that we do by checking restaurants and pools and hotels and nuisance, dog bites, rabies. It's a variety of services. The clinical piece, we do the core services we're responsible for, such as family planning for those women that do not have insurance, and immunizations for children that, are on Medicaid or do not have insurance. And then we do a lot of other counseling services, WIC, which is a huge program for us, for women, infant children, to make sure that they get some nutritious food. We also do a lot of services under offering chronic disease case management or education, such as with diabetes and arthritis and asthma. We also participate and partner with school systems here in Marion County to offer school nursing. That is a non-mandated service, so it has to be fully paid for and reimbursed, not using our local tax dollars. So we're a very eclectic organization that offers multiple services that try to be there for the public to get what they need as far as information and education. And many times our role is just simply to link you to where you can go for the needed service. Again, we only do prevention. That's why we do environmental and some of the programs that we do. Acute care goes back over to the medical provider side. But we link you or try to get you into the services. One of the programs we do that's real challenging is like our breast and cervical cancer program, where women do not have the means, and that's a very time-intensive program that requires a lot of nursing time to help navigate the woman through the system who may have some type of at-risk issue with her mammogram. And so we spend a lot of time working through getting her into a system of a provider or a hospital who can kind of help handle that case if she doesn't have the means to do that. So those are the things we do on a very daily basis with staff that are well-trained, dedicated, and highly functional in trying to assure the women get what they need.
So we want to reiterate that the cutbacks or the change in assistance that's being offered is strictly for the clinical services?
Clinical, right.
So the environmental services, the other services aren't being affected by this
They've
change.
already had their changes. We've already, gone through some issues where we've downsized a little bit. What we've moved to is, we are a district, which makes us a little bit more economically able to handle the multiple programs by centralization of services and assisting what we do in each county. So we have implemented a lot more sharing of staff. Not that we haven't done it in the past, but we actually have implemented sharing our nurse supervisor between Washington and Marion instead of having two move into one. And we'd already implemented that in home health and environmental in the past few years because of funding.
Okay.
So.
And two, we want to mention that the Lincoln Trail District Health Department is, I don't know if it's unique, but it's been part of the managed care for 15 years or so, I think.
Yeah, about 15 years.
And I know with interviews we've done with Senator Higdon that that's the way that all the health departments in the state are moving to. Is that correct?
Right. As of November the 1st, all the health departments have been under the managed care organizations. We've been under just about 15 years. I've been very involved with the Passport model, sitting on their partnership council, and I sit on their board now. Those models work well when done correctly to help, again, navigate the patient through the system to get the services that they need. But we were impacted those years ago where it changed a lot of the numbers that maybe came in for health services by redirecting them to a medical home, again, to try to help organize and do continuity of care. So we're still very important to the plan and work well with Passport on a daily basis by assisting in those prevention services, because some of our counties there's not enough providers, or some providers cannot maybe offer all of the line of services that's needed. So, you know, in some counties we're primarily the ones doing immunizations for the passport patients or the patients that have no insurance. So again, you know, we want to reiterate that the health departments on the clinical side are very much the safety net, you know, that we back up. But we're moving to, the exciting part that we're moving to is focusing more on our population health, where we do more of the community assessment to look at what's needed there. Do you need more diabetes education? Do you need more involvement with wraparound care for our maternal child programs to help, you know, other providers? So we've been giving some flexibility with our funds to do that now.
Okay. So. Now, when the Affordable Health Care Act goes into full enforcement, by that point, everybody should have insurance, or in theory.
In theory.
Right? How will that impact the model? Will it?
Well, we don't know. I'm not sure we'll see a huge difference initially, because there are some opt-outs on that program, and it'll take a while to implement it. We do anticipate that, you know, we'll see more people. That expansion should take in up to about 133% of the federal poverty level. So for Kentucky, that's about 300,000 more to come on. So, you know, it would impact us here. A lot of it will depend on how much providers you have who have available openings to, you know, assist taking on for some of the prevention services we do. And hopefully, as you've seen many hospitals and medical communities doing, they're increasing their provider organizations and bringing in extenders such as nurse practitioners and physician assistants. And that'll be the big key for all of our communities, to see if we can take on, you know, and serve those who now become insured. They're getting services sometimes, but maybe not by the right method. It might be through an ER or acute care. And so to get them into a medical home model where there really is someone to case manage or oversight their care would be ideal. But it is not going to happen quickly. The health department will remain the safety net, and we will be there again for those who may not have the insurance, may not opt for the insurance for a while. We don't know how that'll play out down the road, right. But I think the biggest part's going to still be, are there enough providers in the community that's willing to accept that insurance product? Okay.
And when did this new model go into effect?
For the health departments?
Right.
We started around July, around the 23rd, we implemented the changes.
Okay. So it is in effect now?
Right. We honored those who were already scheduled with us. And again, it's not, you know, maybe 10% or so, that 10 to 15% that were coming in with that insurance. It might vary from county to county, but it's one of several changes we'll see take place as the funding gets challenged.
And it is a funding issue why this happened. If funds change, you know, and the economy gets better, right. Do you see this going back to another, or staying how it's?
I don't see this changing, again, because of the way the medical model's moving toward medical homes and case management and navigation. The thing I believe the health departments will take a more active role in, again, is the population health, where we help with the linkages and the navigation, and those type of services is where I see our role increasing in the future, and being a very active role. I see a lot of programs coming down, probably from state and feds, that to have the health departments focus on opportunities to improve our nutritional education and look at focusing on obesity. Okay. So, and those are, again, what we've been all well trained for, along with those epidemiological outbreak issues. So.
All right, and I've been talking with Linda Sims, who's with the Lincoln Trail District Health Department, and that services Marion, Washington, Nelson County, as well as, I believe, seven counties in our area, including those three. And the changes that we mentioned have gone into effect as of July 23rd. If you have any other questions or need some questions answered, you can contact your health department in your county One other issue, I know in the past you were able to go to a health department outside your county to get services. Is that
That's
still?
changing, and again, it's different in several health departments, but it has pretty much spread throughout the state. Because our funding was changed this year, the formula was driven by your population, the amount of money you collected for the 1.8 cent tax, and your poverty level. For particular programs that are so high cost as family planning and breast and cervical cancer, counties were forced to say, I can only use what funding I get, because again, it's a very limited amount. We get a very small amount of funding, so we do not serve those outside of our district. So in our district, you can come across any of our counties. We do have an exception for for teens, for family planning, because again, we want to be cautious and not have, pregnancies, among teens. And then too, for communicable disease, we don't want that to spread. So we want to stop that at the door, and STD. So you can pretty much come from any county to our county for those 3 services if you're a teen, for family planning, and for anyone for STD and communicable disease. And we'll work with the county that you're coming from. But again, sometimes it's uncomfortable with those to go to the county that you live in, so we like to try to make that open. And most counties are operating that way.
Okay. But again, if you do have any questions, you can contact the health department in your county, and they can help get you those answers.
Be glad to help you.
Well, thank you very much.
Thank you.
All right, I've been talking with Linda Sims, who's with the Lincoln Trail District Health Department. This has been Gary White for Central Kentucky Television.